We're ready to begin. I'll now turn it over to our moderator for the day, Dr. Lippy Roy.
Thank you, and greetings, everyone. Hello and welcome. We're thrilled to have you join us to celebrate the launch of Atlas, Shatterproof's groundbreaking platform for locating high-quality, appropriate addiction treatment. Just a little bit of background on me. I'm an internal medicine physician, board certified in addiction medicine, as well as a speaker, writer, and medical contributor for MSNBC and NBC News, as well as Forbes. I serve as a clinical assistant professor at NYU Langone Health. Previously, I served as chief of addiction medicine for New York City jails, including Rikers Island, overseeing substance use treatment and recovery services at the nation's second largest jail. Prior to moving to New York, I was a primary care doctor to Boston's vulnerable homeless population, among whom the leading cause of death was drug overdose. I also served as an attending physician at Massachusetts General Hospital and faculty at Harvard Medical School, where I taught clinical nutrition and the healer's art. So I was asked to moderate not only as an addiction medicine physician, but also as an advocate for dismantling stereotypes and providing evidence-based information. It's more critical now than ever that we recognize addiction as a chronic medical illness, and that most people with addiction, once connected to the appropriate treatment and recovery services, get better. Atlas gives people access to the tools they need to recover from addiction and breaks down the stereotype that addiction should be hidden away and the people with addiction are stigmatized and ashamed or somehow treated differently from those who experience other chronic illnesses. In the next hour and a half, we'll be sharing with you how Atlas is transforming the addiction treatment space, and we'll hear from special guests and partners behind this much needed innovation. This event is being live streamed by Shatterproof, the national nonprofit behind this exciting innovation. Shatterproof is dedicated to reversing the addiction crisis in America, and the organization brought together the nation's leading experts in addiction treatment and healthcare quality measurement to build Atlas, the first of its kind quality measurement system for addiction treatment facilities. Atlas responds to one of the most pressing issues in addiction treatment. Even though decades of research show that addiction can be treated with the same effectiveness as other chronic issues, it's still incredibly difficult for patients with addiction to find high-quality addiction treatment and care during their time of need. The types of services available in the addiction treatment field vary widely, from clinically effective medical treatments and medications to outdated, ineffective, or even fraudulent practices. The treatment system can be challenging to navigate, preventing some people from getting help in the first place and putting others in a more difficult path to recovery from addiction. In many cases, the lack of trustworthy, reliable information also perpetuates the stigma and misconceptions around this disease. We know that there are dedicated evidence-based providers who want to help those with addiction recover and lead healthier lives, and who want to advance the quality of addiction treatment. In creating Atlas, we're supporting them and many others in the addiction treatment field in empowering individuals and family members, as well as moving the field forward together. Atlas is, again, a first-of-its-kind resource that will provide critical information that's necessary to help consumers identify care. Atlas will offer information widely available for other medical specialties, but so far lacking addiction treatment, information on access, coordination of care, and clinical practices. Over the past 2 years, 6 innovative states have worked together in conjunction with Shatterproof to develop and pilot the Atlas platform. Now that development is complete, Shatterproof will partner with additional states in the coming years with the goal of expanding Atlas across the country and ensuring the same level of transparency exists in all states across the United States. Starting today, Atlas publicly displays validated information on treatment available in the first cohort of states: Delaware, Louisiana, Massachusetts, New York, North Carolina, and West Virginia. This platform will help people find high quality care that best meets their needs and to encourage the adoption of clinical best practices in the addiction treatment space by key players by democratizing data for quality improvement and resource dissemination. As COVID-19 has led to unprecedented challenges that impact access to safe and effective addiction treatment, we see now, today more than ever, how Atlas is needed to help people navigate care. During today's live stream, we'll learn more about the need for, development of, and future uses for Atlas and enjoy a first look at this innovative resource. We have a packed agenda, so let me provide you an overview of what's to come. We are honored to have the Surgeon General, Vice Admiral Jerome Adams, and the Honorable James W. Carroll, the Director of National Drug Control Policy in the Executive Office of the President, join us to discuss the relevance of this work to the addiction crisis in America. Then, Sam Arsenault, the Vice President of National Treatment Quality Initiatives at Shatterproof, will walk us through the Atlas platform. Then we'll have a panel of distinguished state representatives who will discuss how they will use Atlas to improve treatment quality and access within their states. And then finally, we'll wrap up today's event by hearing a few words from two Shatterproof ambassadors who have both been personally impacted by the addiction crisis, and we'll discuss their hopes for Atlas. But first, I'd like to introduce Mr. Gary Mendel, founder and CEO of Shatterproof, to open our program. Gary founded Shatterproof after losing his son Brian to addiction in 2011, with the aim of sparing other families the same tragedy that he and his family have suffered. Previously, Gary spent decades as an entrepreneur founding HEI Hotels and Resorts, a multi-billion-dollar company. That business expertise gives Gary a unique perspective that he's brought to Shatterproof. Gary, in addition, has been a national leader in the addiction space, devoted to creating solutions that will improve access to high-quality care, including the Shatterproof National Principles of Care, improving payment models for addiction treatment, and Atlas, which he'll be telling you about today. In addition, Gary is leading the development of a national strategy to address the stigma associated with this disease that dehumanizes so many people. Please welcome my friend, Gary Mendel.
Thank you. Thank you so much. And thank you everyone for joining us today. I'm truly honored to have with us such a distinguished group to celebrate the launch of Atlas, a resource that is based on science to help those looking for treatment for either themselves or a loved one. And equally important, a foundation to help transform the entire system for addiction treatment across our country. Due to COVID-19, overdose deaths are increasing this year, far more in recent history, as Dr. Lippi just said. One estimate is 40% higher. We need this resource now more than ever. Atlas is years in the making and would not be possible without the efforts of so many of you here today. So from the bottom of my heart, thank you. As Dr. Roy shared, I lost my son, Brian, to addiction. Like so many in our society, Brian became addicted as a teenager, and over 8 years, he attended 8 different treatment programs. And during this entire time, his mother and I frantically tried to navigate a treatment system we did not understand. We struggled to find trustworthy information about what type of care Brian needed. We also didn't understand what quality care looked like. And even if we had, we wouldn't have known how to locate treatment facilities that were following evidence-based best practices. And Brian was also confused by what he was being told at some of the treatment programs. At one program, he was prescribed medication. He then called me the next day and said, "Dad, now they told me they didn't believe in medication. They want me to stop taking it. What do I do?" I didn't know what to tell him. At another program, I asked how they were treating Brian's anxiety. I was told they didn't treat anxiety. Brian just needed to man up and stop using drugs. We were all lost with so little information available. After Brian's death, I struggled to make sense of what had happened. How had I let my son die? But as I did so, I was struck by 3 facts Number one, well-supported scientific research had proven without any doubt that those with a substance use disorder could be effectively treated, with relapse rates no higher than those for other chronic illnesses, such as diabetes, asthma, and hypertension. But, a tragic but, this research, the evidence-based best practices, was sitting in peer-reviewed medical journals, and much of it was not being implemented in our treatment system. I couldn't believe it. Number two, families like mine had not been provided the information they needed to make well-informed decisions about treatment for their loved ones. Again, I couldn't believe it. Number three, the stigma associated with addiction was a killer. Those with this disease were being shunned, shamed, diminished. Approximately 20% of those approximately 20% of those addicted were not seeking treatment as they were afraid of their employers or friends finding out. So many were losing hope, as did my son. I soon made a promise to my son to do whatever I could for the rest of my life to remedy these three facts and create Shatterproof to help do so. And using the rigor of science, the models of business, and the power of working together with wonderful partners, I assure you that we will get this done. Our first step, alongside leading experts, was to draft and gain broad consensus on Shatterproof's national principles of care, core components of high-quality addiction treatment. These principles were derived from decades of research, which had proven, again, without any doubt, to significantly improve the outcomes of patients. We are now working to transform the entire treatment system to ensure that care aligns with these principles by measuring quality, by providing science-based recommendations on type of care, by reforming payment models to incentivize quality, and by changing public policies to enhance professional education for the prevention, treatment, and recovery of addiction. Atlas will help to transform the entire treatment system by delivering valuable information to states, health insurers, and treatment facilities to enable more targeted resources and technical assistance, to help the many hardworking individuals in the treatment industry conduct data-driven and continuous quality improvement. And also, starting today, as Dr. Lippi said, families in 6 states looking for treatment for themselves or a loved one will be able to use this free online platform to take a short, anonymous assessment to receive a recommendation on the most appropriate level of care, and then locate treatment facilities that provide treatment that is based on the most recent science. Atlas is the first and only resource in our nation to offer the level of transparency and trustworthy information on the quality of care that I needed as a parent and my son needed as a patient, and also to provide the information needed to transform the entire treatment system. It is my hope and my clear expectation that Atlas will help millions of families and spare them the tragedy that my family and so many other families have suffered. None of this would have been possible without the tireless work of countless individuals and partners. I would like to thank the organizations that believed in this project from the beginning, our funders, including principal funders Arnold Ventures and the Robert Wood Johnson Foundation, and a coalition of health plans, Anthem, Aetna, Beacon, Blue Cross Blue Shield of North Carolina, Cigna, Magellan, and United Healthcare. We are so grateful for your support. In addition, I would like to thank our state partners in Delaware, Louisiana, Massachusetts, North Carolina, New York, and West Virginia, as well as our dedicated state advisory committee members in each of these states. Their leadership has been critical in bringing Atlas to the citizens of their states and working closely with our team to ensure its success. This is also true of the Atlas data contributors, which to date includes more than 1,200 addiction treatment facilities, more than 8,600 patients, and several commercial insurers. And their submissions would be meaningless without the work of those at RTI International, who helped design the quality measure specifications, analyze the data, and work with Shatterproof to design and build our website. Finally, thank you to the Shatterproof team for their countless hours of work, thousands of miles spent on the road traveling to and within our first cohort of states, and their leadership in establishing a collaborative initiative that will absolutely help so many. In closing, I often think about what turned out to be my son's last visit home. On the last night, the two of us were on the back porch talking about his recovery. I remember him turning to me and saying, "Dad, I wish that someday people will realize that I'm not a bad person, that I'm a good person with a disease. And Dad, I am trying my absolute hardest, I promise." My son did not live in a world where all those who became addicted to alcohol or other drugs would have access to treatment that was based on the most recent science, without any shame or judgment, to give them the best possible chance of living a full and fulfilling life, just like someone with any other disease. But that changes today. It may be too late to help my son and so many other daughters and sons, brothers and sisters, mothers and fathers, spouses and partners. But it is not too late to help the countless others and future generations. If you are looking for addiction treatment, please know that you are not alone. We are working to help you, and Atlas is here to guide you. Thank you so very much. Thank you. Dr.
Gary, thank you for sharing your heartfelt, authentic, and deeply personal story about you and your son and your family and what you and countless families are experiencing in the United States and around the world. Sadly, I too have so many patients I've had the honor of taking care of who sadly are no longer here today. They have succumbed to this disease. But the only way to move forward is through science and storytelling. So thank you. I now have the honor of introducing Vice Admiral Dr. Jerome Adams, although I'm sure he's very admirable too. Dr. Adams is the 20th Surgeon General of the United States, and his mission as the nation's doctor is to advance the health of the American people, and his motto is better health through better partnerships. As Surgeon General, Dr. Adams holds the rank of Vice Admiral in the U.S. Public Health Service, Commissioned Corps, overseeing operations of more than 6,000 uniformed health officers who serve in nearly 800 locations around the world. During his tenure, Dr. Adams has created several initiatives to tackle our nation's most pressing health issues, including the opioid epidemic, oral health, and the links between community health and both economic prosperity and national security. He is also a member of the President's Coronavirus Task Force. In response to the opioid epidemic, Dr. Adams issued the first Surgeon General's advisory in 13 years, urging more Americans to carry Naltrexone, an FDA-approved medication that can reverse the effects of an opioid overdose. Dr. Adams also released Facing Addiction in America, the Surgeon General's Spotlight on Opioids, and a digital postcard calling for a cultural shift in the way Americans think about, talk about, and respond to the opioid crisis. Dr. Adams has pledged to lead with science and facilitate locally led solutions to the nation's most difficult health problems. We are deeply grateful to Dr. Adams for sharing his thoughts on the addiction crisis in the United States and the importance of Atlas. Dr. Adams.
Fantastic. Well, thank you so very much for that too kind introduction. Even though I'm okay with the title of Vice Admiral, my daughter calls me that from time to time, and I accept that. It actually sounds better than Vice Admiral. I appreciate the opportunity to join all of you today to discuss addiction treatment, specifically during this very unique time in which we find ourselves. And I just want to say, Gary, I know how hard this is for you. but I want to sincerely thank you for making efforts to turn the tragedy of losing your son, Brian, into hope for so many others, because that's truly the way we can honor Brian's legacy and really turn your loss into something that can lift up other people all across the country. And so I want to thank you. Every time we talk about it, it doesn't get any easier, but it really impresses upon me the importance of us staying the course. I also want to start by acknowledging all of you in the audience, the health leaders, the community partners, the folks who are recovering, the folks who may be struggling with substance use disorder right now, for participating in today's discussion. Thank you for the work that you're doing to address substance misuse, to lift it up in our nation, and especially during the COVID-19 pandemic. I want to say congratulations on the launch of Atlas in New York, Massachusetts, Delaware, North Carolina, Louisiana, and West Virginia. And I know we keep repeating those states, but it's important that we acknowledge people out there who are taking steps forward in something that is really taken far too long for us to recognize as a problem, and even longer to try to offer solutions for. So we want to recognize those states. I look forward to hearing about your progress and the contributions this platform will make to our shared aim of high quality, accessible treatment for anyone battling substance use disorder. And Gary hit these points home. High quality and accessible have to be key. In many cases, if it's not available when someone needs it, then it might as well not be there at all. And if it's not high quality, if it's not providing people with evidence-based treatment, then again, in many cases, you can do more harm than good. I want you all to know that as the nation's doctor and as a practicing anesthesiologist, one of my priority areas during my tenure as Surgeon General has consistently been addressing substance misuse, and specifically the opioid epidemic. Throughout my career, I've been focused on the root causes of addiction and the forces that make it harder for people to seek treatment, such as stigma. Many people and organizations around the country are promoting interventions to prevent addiction in the first place, and that's a key part of this also. Today, we're talking about treatment, but we have to also focus on preventing people from going down the pathway in the first place. And Gary talked about Brian and his anxiety. We have to focus on treating mental health conditions and making treatment more available, destigmatizing mental health conditions. We need to raise awareness of the impact and prevention of adverse childhood experiences, because we know in many cases, the substances that people are misusing today are a result of the trauma that they've experienced sometimes decades ago. And speaking of which, we need to better promote trauma-informed care so that when people come in and we have that touch point, we aren't re-traumatizing them or pushing them away, but rather extending open arms to them and letting them know that they're in a safe place. You heard about my spotlight on opioids. You also heard about my digital postcard, and I would ask all of you to share that digital postcard, which lists 5 steps that everyone can take to respond to the opioid epidemic. It's still timely. It's still timely because this opioid epidemic is a behemoth. And it's easy for people to say it's too big of a problem for me to do anything about alone, so I'm not even gonna start. That's why I put out that digital postcard, to give everyone across America 5 tangible steps that they can take to respond to the opioid epidemic. You can find that digital postcard at surgeongeneral.gov, and I'd ask that you share it through your social media channels, share it up, let's put it up at work. Again, if we can get one person to do one thing, and we can multiply that by 330 plus million Americans, we can have a significant impact on the opioid epidemic. And as many of you all know, in April of 2018, I issued the first Surgeon General's advisory in more than 10 years, which highlighted the importance of naloxone access and use as a way to curb opioid morbidity and mortality. This advisory, along with efforts from HHS and ONDCP, resulted in an over 400% increase in naloxone dispensed across the nation. Quite frankly, thanks to your efforts and your partnership, we have saved tens of thousands of lives. As many of you have heard me speak about in the past, I'm passionate about this because for me and my family, as for Gary, the opioid crisis isn't just pressing, but it's deeply personal. My baby brother, Philip, recently finished serving prison time for crimes committed to support his addiction. Philip suffered and continues to suffer from mental illnesses and conditions, but unfortunately, for years, they were untreated. And he turned to an array of substances to self-medicate. I share my family's struggle to illustrate that addiction can happen to anyone in any family, even the family and the brother of the United States Surgeon General. I share my story in the hope that it gives others the courage to share theirs so that together we can fight stigma. Because there are far too many people who look around and say, well, this can't happen to doctors. This can't happen to successful business owners like Gary. Addiction can happen to any one of us and any one of our families. And I truly believe stigma is one of our biggest killers. It kills as many people as cigarettes. It kills as many people as sugar sweetened drinks. It kills as many people as any other risk factor out there. And unless our loved ones and our families feel comfortable seeking help, we will never be able to reach those who need it the most. I want to note, as an African-American male, that in my experience, stigma is particularly apparent in communities of color and in rural communities like the one I grew up in. And it's no coincidence that these are the same communities that are being hardest hit in many cases by substance misuse. And it's not a coincidence that these same communities have also been particularly hard hit by the COVID-19 pandemic. We know the reasons are many, and they're rooted both in pre-existing medical as well as social conditions that conspire to reduce resilience, opportunity, and health. And COVID-19 is exploiting and exacerbating these pre-existing health disparities, including substance use disorders. According to a recent issue brief released by the American Medical Association, we know more than 30 states have reported increases in opioid-related mortality coincident with the COVID-19 epidemic. In order to address this, an essential component of any plan must be governors, legislatures, local policymakers, and communities supporting safe access to high-quality addiction treatment programs. Providing patients and loved ones with reliable and timely information to help them access these programs is critical. In short, it is really a matter of life and death. So while addressing COVID-19 should and will remain a top priority for many people out there, we must not forget about the other health issues that not only exacerbate the virus, but will also be exacerbated by the virus and will be present long after this pandemic ends. That being said, as I'm sure you've all heard, we've seen a rise of new cases of COVID across the nation. And if we don't act fast, this will inevitably lead to a rise in human suffering, compounded by shortages in testing and medical resources. The good news is we know what works to keep people in their communities safe. The power to slow this virus literally lies in the hands of all of you, all of us, the people of this nation. While we're gathered here today to celebrate the addition of a useful resource for those battling substance use disorder, I'd be remiss not to remind you that our best immediate defense against COVID-19 and against shutdowns and against, again, a worsening of other diseases and other conditions like substance use disorder are those tried and true public health practices that you hear me talking about on TV and on social media all the time. So I ask that you please help me reinforce this advice to others. Wash your hands frequently and thoroughly. Maintain a safe distance, at best, at minimum 6 feet from others, and wear a face covering in public to protect others. These things really are an instrument of freedom, because if enough people wear them and practice at least a minimum of 6 feet of social distancing and practice good hygiene, then we can keep more places open, including substance use disorder, addiction, and treatment recovery programs. We need to make sure we're doing everything possible to get people the help that they need. And part of that is wearing a face covering. And finally, stay home if you're sick. My final request to all of you is that you seek to incorporate health equity, which means making sure everyone is getting the resources they need to thrive, into all of your efforts. Overdoses are improving in some subsets of our population, and they're worsening or plateauing in others. But that's why we must all work together to eliminate these disparities and to generate better health outcomes for all. We're facing an unprecedented challenge, fighting a global pandemic while continuing to expand access to life-changing and life-saving treatment to individuals fighting substance use disorder. This tremendous fight is also an opportunity. It is our opportunity to reinvent a nation that is healthier, more resilient, and more just. And so I want you all to know that in the midst of tragedy, I remain optimistic. I remain hopeful that 10, 20 years down the road, we will look at this as a turning point in the way we address substance use disorder, a turning point in our fight against stigma, a turning point in our recognition of how various diseases have a disproportionate impact on certain communities, and a turning point in our resolve to do better. Together, I know we'll get through this, and I thank you for the opportunity to address you today.
Dr. Adams, thank you so much for sharing not only your personal story with your brother, but also talking at the intersection of addiction, of race, and of COVID-19, and specifically addressing the needs of vulnerable populations, Black Americans, as well as Hispanic Americans, Native Americans, and unfortunately, people who still experience substance use disorders who have so many unmet needs. Thank you so much, Dr. Adams. And thank you for, I have my apologies for the admirable and admiral mess ups, but you are definitely admired by all. Thank you so much again. Next, we will hear from the Honorable James W. Carroll, the Director of National Drug Control Policy in the Executive Office of the President. Director Carroll was unanimously confirmed by the U.S. Senate and sworn in on January 31st, 2019, after serving as the acting director and deputy director from 2018. Prior to joining the Office of the National Drug Control Policy, he served as assistant to the President and Deputy Chief of Staff at the White House. Previously in the administration, Mr. Carroll served as General Counsel of the Office of Management and Budget and as Deputy Assistant and Senior Counsel to the President. During the George W. Bush administration, Mr. Carroll held several positions, including Special Assistant and Associate Counsel to the President at the White House, Deputy General Counsel and Acting General Counsel at the U.S. Department of the Treasury, and as an attorney at the U.S. Department of Justice. Mr. Carroll began his career as a state prosecutor in Virginia. The Honorable Mr. Carroll. Thank you, sir.
Thank you, Dr. Roy, for that wonderful introduction. For those of you who I haven't met, I am very grateful to serve as President Trump's Chief Advisor on Drug Policy. ONDCP works across the federal government and with nonprofit partners like Shatterproof to expand access to high quality and safe treatment across our country. In my role, I have spoken with countless individuals whose lives have been touched by addiction. And while every story represents a unique struggle, I hear one theme repeated again and again: the importance of family. I have heard about a daughter who was terrified to tell her parents about her addiction, only to find out that they embraced her when she finally told them about her struggles. I've spoken to a veteran who credits his son for giving him a reason to sustain his long-term recovery. And maybe you know my own story. More than 2 years ago, a family member came to my wife and me to say that they needed help with their addiction. What followed were amongst the most difficult moments in my life. And like many other family members who have taken on this incredibly difficult role, my wife and I struggled to determine what type of treatment was best suited for our family member and which treatment facilities were using evidence-based practices. Each website we consulted, each individual we spoke with, offered us differing advice. It was up to us to make sure that our family member received the help they needed. In short, we would have benefited tremendously from a service to navigate all of the information on addiction treatment programs like Atlas. And for that, I want to thank Gary and the rest of Shatterproof team for alleviating the stress and suffering of families who will have to one day take care of a loved one struggling with addiction. Shatterproof has always recognized the importance of supporting individuals and their families and ensuring that both have the right knowledge, tools, resources, and support they need to navigate an extraordinarily difficult time. I'm happy to report that my family member successfully received treatment for their addiction and is now in long-term recovery. I am confident that Atlas will help many other families say the same in the future. For the first sentence in Shatterproof's mission statement is that they are working hard to transform addiction treatment in America, and Shatterproof is being remarkably successful. I want to once again thank the Shatterproof team and all of you for the work that you continue to do to save lives. Gary, we do this work together in memory of Brian and all the others who we have lost to this disease. On behalf of the Trump administration, I want to thank you all and God bless you.
Thank you, Director Carroll. Thank you for sharing your own personal stories and struggles with your family when it comes to addiction. And thank you for sharing your mission, your agenda of your office in terms of getting people the care that they need and deserve. And like I said to Gary before, the only way to move the needle forward in the addiction treatment space is through science and storytelling. So thank you. We've heard about the scope of the addiction crisis in America and how so many struggle to find help that will put them on the path to recovery. Next, I'd like to introduce Sam Arsenault, the Vice President of National Treatment Quality Initiatives for Shatterproof. Sam has led the development and implementation of Atlas since its inception. Sam is going to take us through the Atlas website, treatmentatlas.org. Take it away, Sam.
Thank you, Dr. Roy. Atlas, or the Addiction Treatment Locator Assessment and Standards Platform, has been in the making for nearly 3 years, and I can't thank all of those involved enough. In addition to the groups named during Gary's remarks, we will list our key stakeholders at the end of the event. But right now, I'm so excited to take you through the public view of Atlas, available now on treatmentatlas.org. In building this site, we strive to meet the needs of multiple user groups. First and foremost, someone looking for addiction treatment for themselves or a loved one, but also addiction treatment providers to create a learning healthcare community that will foster measurable quality improvement for years to come, as well as health insurers, employers, and other payers to be able to align financial incentives with best practices in addiction treatment, enabling payment based on quality over quantity. And finally, state policymakers to remove barriers faced by the addiction treatment workforce and to support in upholding a standard of care for addiction. To do this, we needed to blend the best of healthcare with the best practices from other industries like travel and e-commerce. We've worked to combine rigorous healthcare quality measurement techniques and a consumer-friendly interface. Often, when someone is looking for addiction treatment for themselves or a loved one, they don't know what to look for. I've even felt this desperate panic, and I work in this field. And many people's ideas about addiction treatment are not our best practices that are highlighted in Shatterproof's principles of care, which are highlighted throughout Atlas. Instead, people find treatment based on notions shaped by pop culture references to luxury rehab, the lived experience of a friend or neighbor, or the information that we find online, often reaching us based on a covert bidding war for AdWords rather than on medical research. Starting addiction treatment in the wrong place can lead to devastating outcomes, depleted savings, and discouragement. That's why the first step of Atlas is the Addiction Treatment Needs Assessment, created by Shatterproof in partnership with Open Beds and the American Society of Addiction Medicine. This anonymous assessment, which I'll take you through, allows you to quickly answer 13 questions on behalf of yourself or a loved one and provides guidance on the type of treatment to look for based on the person's risk or severity. Here you'll see I've already completed the assessment for myself as if I have a problem with alcohol and do not have a safe place to live. Once you submit your results, you'll receive a recommendation about the type of treatment that you need. For this search, I'll search as if I'm in Worcester, Massachusetts, where I used to live. I can scroll through facilities by the type of treatment that has been recommended to me, or I can use a map to search, clicking on a facility that looks most convenient for my daily life. At the top of the facility's profile, you'll see that there is a descriptive information about the facility, like their mission statement and the types of payment they accept. When you scroll down on the facility, you can see the signs of quality care. This information aligns with Shatterproof's national principles and is an indicator of whether or not the facility offers services on the site at a different location or whether they're not available. This data was gathered through the Shatterproof Atlas Treatment Facility Survey and was submitted by more than 1,250 facilities across our 6 phase 1 states, or more than 50% of facilities. In some cases, features included in the measures may be less important to you or a loved one, like whether or not the facility offers medications for opioid use disorder if you don't have an opioid use disorder. So it's important to read these measures to understand what they mean. For context, 59% of facilities that responded across the 6 states offer buprenorphine, 57% offer naltrexone, and 17% offer methadone. If this is a factor that's especially important to you, Atlas allows you to search by this criteria. Let's go back to the search page and change our filters. This time, we'll look for an outpatient facility that offers medications for opioid use disorder and that accepts my private health insurance. Again, you can search the facilities that are listed, or you can use the map to click a facility and view their profile. You can see here that the quality measures have now changed to show what's available at this facility. For example, we can see that this facility does offer medication since that was a filter that we used, and we can also examine which evidence-based behavioral therapies are available. Through our expert-driven quality measure development process, we determined a minimum level of rigor for behavioral intervention to be included in Atlas, meaning we won't display practices that aren't shown by evidence to help people with addiction. The level of rigor needed is demonstrated efficacy in 2 randomized controlled trials and 1 large field study. Practices that don't meet this level of rigor for treating addiction, like equine therapy, might be available at the facility, but are not shown in Atlas. You can also see that this facility does not offer primary care on site, but they do offer some testing. Across all facilities that submitted data to Atlas, only 20% offer primary health care on site, including via telemedicine, and 10% of facilities offer primary care off-site at a different location. So you'll see that there's large variation in what might be available at each facility. Finally, you can see which recovery support services are available. 97% of facilities that responded to Atlas offer some form of recovery support. The most commonly provided recovery support service is assistance obtaining social services, which is available at 76% of facilities that responded. 57% of facilities that responded offer peer recovery services. Below the signs of high quality care, you'll see patient experience feedback. This section includes questions from the CAPS and ECHO patient surveys that were developed by the Agency for Healthcare Research and Quality. The patient experience section appears when there are more than 20 responses for the facility and is updated every 24 hours. You can see that this facility has 29 responses and that you can review the average for multiple choice questions, as well as read reviews from other patients. You can also submit a review on a facility profile. By clicking the button, you can leave anonymous feedback as the patient or a loved one. The reviews are subject to natural language processing to protect people's identities and to additional screens to prevent gaming and serial completion. If a facility did not complete the treatment facility survey and the subsequent validation protocol, they're still listed in Atlas, so you can leave patient feedback, but they are not displayed in the default search. Let me show you. In order to view these facilities or the full list of facilities in these states, you must click out of the quality data provided filter. This will enable you to see all of the addiction treatment facilities in the state. And when you click on a facility that has not submitted the treatment facility survey, you'll see that data is not available, but you can still leave a review on this facility. You can click on the About Atlas Data page in order to learn more about the multi-year iterative process to develop the quality measures that are used in Atlas and the data collection for these groundbreaking tools. The measures used to inform Atlas include data from a treatment facility survey, the patient experience survey, which is ongoing, and health insurance claims. This will all be made available to providers and partners in the coming months to use for quality improvement work. Finally, this work would not be possible without the dedication from so many within Shatterproof and across our state partners. A special shout out to the National Treatment Quality Initiatives team and all of the partners across the Phase 1 states. Another big thank you to all of those involved. In closing, there's a ton of information on Atlas that I know will help so many people, but this system is only available in 6 states at this time. We're already working to expand Atlas to other states, so if you'd like to be a part of this, please reach out to us. Thank you all so much, and Dr. Roy, back to you to continue the event.
Well, thank you, Sam. It's clear that so much effort and resources have been put into the Atlas platform. And it's also clear that Atlas meets a critical need for individuals and families who are searching for care. You described how the data underlying Atlas provides incredibly useful information and reveals trends of the use of best practices in the addiction treatment field. This is a good time to shift to our panel discussion and hear from the states who have worked with Shatterproof to implement Atlas. Today, they'll be talking about their experiences and where they see Atlas headed next. These states are pioneers of healthcare innovation and have worked diligently over the past 2 years to help develop a platform that will pave the way for improved patient access to quality addiction care. One of the key goals of the initial piloting of Atlas was to develop a platform that would operate effectively across a wide variety of states and geographic regions. State agency partners have spent countless hours completing testing, offering ongoing guidance on state-specific challenges, and convening key constituents in their states, and deciding internal staff and dedicating internal staff to conduct the various activities necessary to populate the initial Atlas database. They have inspired with their leadership and their ability to bring together diverse groups of stakeholders, both public and private, to make this project a success. On our panel today, we are representatives from state agencies that partnered with Shatterproof to implement Atlas. In alphabetical order by state, we have Elizabeth Romero, Director of the Division of Substance Abuse and Mental Health, Delaware Health and Social Services; Karen Stubbs, Assistant Secretary of the Office of Behavioral Health at the Louisiana Department of Health; Abby Auerbach, and I'm sorry, I just noticed this is not in alphabetical order, so I apologize, Assistant Commissioner and Director, Office of Population Health at the Massachusetts Department of Public Health; Patricia Lincourt, a licensed clinical social worker and Associate Commissioner at the Addiction Treatment and Office of Addiction Treatment and Recovery with the New York Office of Addiction Services and Supports; and Robert Hansen, Executive Director of the Office of Drug Control Policy for the West Virginia Department of Health and Human Resources. We'll start off by having our panelists share a little bit about Atlas implementation in their respective states, and then we'll move to a panel discussion. I think we'll have, is there a specific order? I think maybe Miss Elizabeth Romero to start.
Absolutely. Thank you so much, Dr. Roy. In Delaware, our Division of Substance Use and Mental Health launched a quality improvement initiative in October 2018 to increase access to care and treatment for individuals living with substance use disorder. As part of this initiative, DSAM began tracking quality and clinical measures for addiction treatment across the state, which we then share back with providers to help them improve their services. The partnership with Atlas helped to enhance these efforts by providing a common set of measures for providers to benchmark themselves against, not just for in Delaware, but across the United States. Atlas will also complement existing resources in Delaware by providing transparent data on the use of evidence-based medical practices and the quality of care based on patient experiences at treatment facilities across the state. Ultimately, we need Delawareans and those across the country to not struggle to find quality treatment, as Gary and our other many families in Delaware have. And so we think of this as one tool that really will help ensure people see the quality care. And
Thank
I believe.
Sorry. Thank you very much. I'm amazed, and as somebody who actually lived in Wilmington, Delaware, I have warm views and feelings. So thank you so much for the important, critical work that you are doing. How about if we introduce Karen Stubbs in Louisiana? Oh, can you just take off mute?
Right, can you hear me?
Yes.
How many times a day does everyone hear that these days, right? So I had prepared a statement on why Louisiana chose to participate in our hopes for this work. And after Gary's introductory statement, I'm not sure that I could say it any better, so I'm not going to try, but wanted to point out that Louisiana had the same perspective when we chose to participate, which was about the challenge of finding treatment and the value of this locator tool to families. Implementation in Louisiana specifically happened hand in hand with our providers. That's something we're very proud of, that from the very beginning stages, we went to providers and said, we want this to be a partnership. So that's an overview about why Louisiana participated and a high level overview of how Louisiana implemented, which is with providers and in conjunction with them.
Thank you, Karen. And again, I also lived in Louisiana. It was my home when I did my medical training in New Orleans, Louisiana. And I have a very, very warm spot in my heart for Louisiana. So thank you for the really critical work that you're doing there. How about if we go to Abby Auerbach at Massachusetts Department of Public Health? And I will again add, and I had nothing to do with this, but I also lived in Boston, Massachusetts, where I was a primary care doctor to Boston's homeless population and worked with the Mass DPH very closely. So take it away, Abby.
Actually, this is Jim Creamer. I'm sitting in for Abby today. So I'm the, thank you. I'm the Deputy Director for the Bureau of Substance Addiction Services at the Department of Public Health. So thank you. Dr. Roy, you should just tell us where you haven't lived and been. Might be quicker. So with that said, I think some of the other folks covered some of the things I wanted to say, but sort of going off with Karen Stubbs was saying, I think this is a process that or an initiative that we've been thinking about for years in terms of trying to develop a consumer-facing dashboard that really looked at quality indicators and provided a consistent measuring system for a consistent look at this across the board. In Massachusetts, we have a fairly robust provider system, which is a great thing to have. We've built this over many, many years in partnership with the providers and advocacy groups out there. But with that said, the flip side of that is we do have a very complex and large system, and navigating that system can be very, very challenging. I know going back in my history, one of the tasks I used to do was get calls from family members on the phone. And the situation with folks in crisis was often a very challenging one, trying to find the appropriate treatment for their family member or other loved one in a time of crisis was something that was very daunting and provided additional stress at a time when access to treatment was needed. So with that said, continuing to do quality improvement and quality assurance, I think is a very big part of the Massachusetts strategy. Implementing this tool and incorporating it with the other tools that we have in the state, in partnership with the providers and advocacy groups, I think is important because this thing was not built by the state of Massachusetts or Atlas. This was built by all these different stakeholders, and each state has very unique aspects. So going forward, I think this provides an additional tool for our toolbox, and the hope is that it's going to get integrated with the other tools we have and really provide a broader picture for folks trying to access treatment services.
Thank you, Jim. Thank you for stepping in for the Assistant Commissioner and the Director, and for the critical work that you're doing in my former home state, where there's clearly a lot of services going on. So thank you, Jim. Next, how about if we introduce Pat Lindcourt, my former colleague at OASIS. Take it away, Pat. And I want to make sure you're off mute, Pat. Is Pat there? If not, how about, well, maybe there might be some technical issues. Let me go to Mr. Robert Hansen, who will tell us about the work at West Virginia. Take it away, Mr. Hansen.
Yes. As the staff at Shatterproof know, we were extremely excited to participate in this project. Early on, our emphasis in our state was improving access and creating greater capacity to help people. Well, what was missing was that quality element. So participating in this process in cooperation and partnership with the providers has been really enlightening, because it's enabled our providers to look at themselves in a different way, where they're not just focusing on access and building and increasing capacity, but also looking at that quality element. The process has been really positive for us, and we're excited to be able to offer family members and people who have substance use disorders a lot more information. When someone needs help, they need as much information as possible. So it's been a great experience in our state.
Thank you very much. Do we have Pat Lindcourt? Is she on the line? Just gonna make sure. Okay, so we will keep moving forward. But first and foremost, I'd like to share my thoughts as a former primary care doctor, but also an addiction medicine physician, to all of the panelists for truly the key work that you are doing, critical work that you are doing. I often share, when I give talks on addiction nationwide, I always remind people about this key WHO statistic, World Health Organization. Drug addiction, according to the WHO, is the most stigmatized social problem, not even a health problem, social problem. Drug addiction is more stigmatized than poverty, homelessness, incarceration, which also incidentally are issues that our patients with addiction not infrequently experience. So we have to collectively work together. Public health, policymakers, the medical communities, drug policy folks, activists, teachers, everybody needs to come together, because I cannot think of another health issue that does not directly or indirectly impact all people from all walks of life. So let's move forward. Oh, I hear that Pat is having some technical issues. She will call back, and when she is back on the line, we'll definitely would love to hear from her. So as we move forward, I want to ask my team, one second here. Give me 1 second. I want to start with the question of what challenges, what would you say are maybe the big one or two biggest challenges that you have faced at your state? Maybe Elizabeth, I'll start with you.
Sure. As it relates to substance use treatment disorder, and especially in this COVID crisis, some of the big challenges we have is making sure people have information on what resources are available in the state related to substance use treatment, and resources that support their wraparound support, transportation, housing, food insecurity. And so we've really been partnering, and having this type of tool, having this quality measure in place is really critical, so that people know where to go, know how to find things. And the other part is during, again, the COVID epidemic, we had folks that are in-house and homebound with someone that they love, and they're trying to figure out, well, what do I do? How do I help them? So having these types of things available to people so that they're able to, again, access a quality program, because unfortunately, there's lots of bad actors out in the field. But in our state, I know that we're able to say that we have a lot of quality programs in our state, and being able to highlight highlight things like that on our platform is really critical. So we really feel like, again, this type of partnership is very important.
Thank you, Elizabeth. And before we move to the rest of the panelists, we have Pat, my former colleague at OASIS, back. So Pat, please let us know your input, please.
Yes, hello. Hi, Dr. Roy. Really good to see you. Great to be on this panel with all these distinguished other guests from other states. I did, our hopes for being on, working with Atlas have been pretty consistent over time. We really also, echoing some of the things that I've heard from other states, have excellent programs in the state that we want to be able to, help them to be able to let others know what the services they offer. And so we are interested since this launch in hearing from our providers and from people who are seeking treatment, what the tool can do for them and what their experience with it is.
Thank you so much, Pat, and thank you to OASIS as an agency for providing the care that they do to all New Yorkers. So I'm going to go back to some questions. Atlas produces an incredible amount of new data on the use of best practices in the addiction treatment field in all of your respective states. Now each state is different. And may use the data in different ways. But how does your state plan to use this data? Pat, why don't you start?
Yeah, so that's something we've done a lot of thinking about. That really is a rich array of information directly from the providers. And one of the things that we're thinking is that it fills in some gaps in our knowledge. For instance, we would be able to know across the state where evidence-based practices there may be some gaps for service providers, and we could then encourage the development of those. Also, service gaps just in general across the system, and help us to monitor where evidence-based medication is available or where it's lacking as well. And we're also talking to providers who will have some data themselves about their performance on measures to integrate into a continuous quality improvement. So we're excited about that.
Thank you so much, Pat. Yeah, a lot to be excited about. How about we go to West Virginia? Bob? Off mute.
Yes, and one of the exciting things about this information is really the patient experience and having that publicly shared. So I think that will give all of us in our state an opportunity to look at that information and remind ourselves how important it is to be listening to our patients. This also gives us an opportunity, our providers an opportunity to look internally among them and see what they need to do to improve themselves. And it really sets our state up. And we've said it multiple times, starting with Gary, about continuous quality improvement, but it gives us an opportunity as a whole state to engage in that whole process where previously perhaps we haven't been paying enough attention to this quality end. So we're excited about that.
Thank you, Bob. There was a weird little echo coming from your side this time. I'm sure there was some little glitch. Karen, anything to add for Louisiana?
Yes, hi. So we are particularly interested, the facility survey data collects some indicators that aren't currently available to us at the state level. So I find that pretty interesting, but I think over time, the patient experience data as it's collected is going to be a hugely valuable tool for peers, for people in search of treatment. So that's something that's very exciting for us.
Sorry, fantastic. Thank you. Jim, anything from Massachusetts?
Just quickly, I would add that, quality improvement, quality assurance, I think is center in terms of where we want to focus. But in terms of looking at system issues versus program specific issues, I think one of the hopes is that we can use this data source as an additional source of information to help identify where there may be gaps in the system, where access to services is not happening or is not happening in the correct way. And in Massachusetts, we're very focused in integration of care. primary health care, along with mental health services and other comorbid conditions that may exist. So looking at like, how is the system currently aligned to meet those needs? Where can we put additional resources going forward to shore up the system? And doing it in in this current environment where information and data that's timely is so important, because things are changing so quickly, just as we all experienced in March, with COVID-19, how things can just overnight really be put on its head. So, timely data is important, but using that data in conjunction with the other sources of data, I think is really what we're looking for in terms of, planning ahead for the short term, but also mid and long term, I think is what I would say.
Yeah, no, what a key point. I mean, this pandemic has shown us what a stark reminder that being flexible and adaptable is just so key. Anything to add, Elizabeth from Delaware?
I would think one thing that, as we move online, is really looking at broadband and internet access and telehealth access for actual people is going to be an important indicator for continuing treatment as we have to close and reopen, and really being sensitive and flexible to keep people engaged in treatment. And so, again, we want to make sure that people are connected to quality treatment providers that are not going to just administratively discharge them without trying to make sure that they identify and bring them back into care. So we think that, again, the quality is very important, and for families to understand how to access that quality is critical.
And you just kind of hit the nail on the head and leading me as a nice segue to the next question. We want every person in need to be able to access and know about Atlas in their time of need. How do you plan to make sure people in your respective states know about Atlas? Jim, I'll start with you on that one.
Okay, so sort of in line with the information, how information is disseminated these days. Social media, we plan on using all the social media outlets that we have access to, Facebook, there's Twitter accounts. So doing sort of that level of information and marketing, I think is definitely a strategy. But I think I want to take a step back from that. This is something that the build of this initiative really involves not just the state entities and the state partners. Mass Health is very involved in this as well. But it really involves the provider system. It involves consumers, it involves the advocacy groups and provider groups out there. So taking a step back and saying, gee, how can we collectively in Massachusetts work together to really promote this? We have institutions and other initiatives such as Learn to Cope in Massachusetts. There's the MORE, Massachusetts Organization on Addiction Recovery, which are very in tune and plugged in with sort of what's happening in the local communities and so forth. So my hope is to work collectively with these other entities to really to promote this on that level, and to really look at what are the results and outcomes, because I think success will breed success in many respects. And to what extent this tool is being used and is being used to better access to care and quality care that's appropriate for that individual is really going to be the basis of which we're going to build off of, I think.
Thanks, Jim. That's great. What about Elizabeth in Delaware? What are you guys doing about access of people in Atlas?
Absolutely. So for us, and I'm sure my colleagues in Louisiana, West Virginia, Massachusetts, and New York can attest to, is that there's an information overload as we're trying to really help people find things consistently. So we have a helpushere.de.com website, and so we're actually putting links and making sure that we're driving people to a consistent location, and then from there, they're able to access the services there. And so we are really trying to be consistent. And again, I appreciate too what Jim is saying. Social media is hard, and just trying to make sure, again, you're breaking through the noise. So we're trying to create a place where people can go in our state, and then adding and putting those evidence-based and quality resources right there for people to find.
Thanks, Elizabeth. Pat, what are we doing to let New Yorkers know about Atlas?
So many of the same kinds of things. We have some very robust media campaigns currently for preventing overdose. And so we want to integrate the Atlas tool into some of what we're currently doing, both on social media and then in other kinds of media markets. And, and also getting it through, I think that grassroots idea, through our recovery movement here in New York.
Excellent. Karen, how about Louisiana?
Hi. So in Louisiana, our communication plans has several avenues, some very traditional ones that include things like press releases and social medias. Also some more grassroots type of outreach that include things like old school poster distribution, conference promotion. We're hoping to maybe make some connections with our university partners. And then, of course, as I mentioned before, promotion through our provider associations that have pretty broad reach and scope and audience outside of just the providers that are parts of the association. So multi-pronged.
Fantastic. Last but not least, Bob, let us know about West Virginia.
Yes, much of the same things that everybody's already mentioned, but I think there's two key to being successful in getting the word out. And one is being consistent in our messaging over a long period of time, and also being persistent in getting the word out. We can't just do a blast that covers a few months, but we have to be promoting and using this information over the long haul. So that's got to be a key ingredient as we roll out this plan.
Thank you so much, Bob, and thank you all for your wonderful responses. This will be the last question because I want to be mindful of time. If you can just try to keep your answers brief. So the necessary public health precautions to prevent the spread of COVID-19 are exacerbating challenges related to addiction, including fear, isolation, and stress. What should we be doing to make sure, as we address the pandemic systemically and in our own lives, to make sure we don't lose sight of the addiction crisis? I'll start with you, Bob, and then we'll go to Jim and then Pat.
Yeah, there's no question that the pandemic kind of sucked the air out of the room for us as we work on the epidemic. And we have to adapt to that, and that's really very important to us. We know that there's an increase in overdoses in our state, and we are working on many strategies to mitigate that type of thing. But most importantly, we need to be sure that we're keeping people connected as much as possible through virtual support group meetings, access to helplines 24 hours a day, 7 days a week, and using technology to our advantage. One of the things we're doing in our state is rolling out a statewide app called Connections, which allows our patients to be connected to the providers, but also to be connected with each other. So we've got to be creative. We have to continue working with everybody and work through the issues.
Thank you so much, Bob. Jim?
Thanks. So, addiction is can be characterized as something that leads to isolation, in itself. So, and COVID-19 obviously just exacerbates that to the nth degree. And so with that said, in Massachusetts, we've been doing a lot of things I think other states have been doing, trying to promote telehealth, ensure that technology is available to patients and clients out there, working with providers to ensure that they're stabilized right now, because I think a lot of providers in the system have been also affected, with this as well. I mean, they have staff that are dealing with the same issues that we all are. The utilization of programs has been not consistent. So there's a lot of challenges in terms of ensuring that this system stays intact, and that the services continue to happen, and that people are able to access this currently, but also in the future, because this COVID-19 is going to be an ebb and flow kind of scenario. And so how do we sort of take steps to ensure that the provider system is supported going forward, so that the way they can provide services to the clients, I think is something that I'm thinking of all the time. So.
Thank you so much, Jim. How about Pat?
So as everybody was talking, I was thinking that COVID-19 has really disrupted the way services are provided across healthcare, and definitely specifically to SUD. But it's brought opportunities too for us to be able to reach to people who may not have been as open to or as able to come to services through telepractice. So by really innovating, our providers have kept services open throughout the entire crisis, and been able to make that turn quickly. I think that as we move forward, through the COVID pandemic, we need to stay connected, use some of the new opportunities we have to get medication-assisted treatment to people very effectively, and also learn from this what we should keep going forward, and really take the lessons from this time, the things that were effective. So we're also looking to evaluate how this went. So thank you. That's a great question.
Thank you, Pat. That was great. Let's go to Karen and then Elizabeth.
So in Louisiana, from the beginning, we were very mindful to not stop the SUD conversation or have it overshadowed by conversation around the pandemic. And in fact, more recently, we're starting to see the pandemic highlight SUD and treatment needs, and we're starting to leverage the public's attention and promote the conversation. We've done a few things, such as we're currently in partnerships with a specific provider to create an entire COVID positive unit in a residential treatment facility to be able to continue or initiate treatment with a COVID positive diagnosis. And we've also done things like create a COVID support hotline that's specifically for people in recovery. So taking the COVID conversation and really focusing on the needs of people who are in recovery or need access to those services.
Thank you, Karen. Bring it home, Elizabeth.
Well, I'll just echo and say ditto to all the great things that our colleagues said, because absolutely we are facing that in Delaware as well. And really also trying to harness all the different online resources for people. So we've been trying to create behavioral health online groups that our providers have done and put it in one central calendar for people. But then also social determinants. We've been really trying to partner with our food pantries and all the different outreaches, because we need to reach people where they're suffering the most. And so that's where we've been bringing our team to where those folks need to be. And then the last part is just addressing some of the issues of racism and systematic injustice going on. Our communities of color are suffering during this, and then we recognize the importance of addressing the stigma related to substance use and the harms that have been done to many of these communities. So partnering with law enforcement to keep people out, we've had a great relationship with our Delaware State Police and also many of our Newcastle and law enforcement throughout the state. And then also really thinking about ways to really reach into the community to find peers so that people can help walk their journey together with them. It's very important, especially in this time as people are more isolated and then also fearful.
Thank you, Elizabeth. What I heard there was just really meeting people where they're at, which is really adopting the harm reduction philosophy, which I think is going to be key. And what I heard almost all of you say, either directly or indirectly, was this important C word, which is connection. A very common saying in our field is that the opposite of addiction isn't sobriety, it's connection. And to Pat's point, yes, the pandemic disrupted a lot of that connection, but it also created opportunities, which clearly all of your states are capitalizing on. You know, it's so it's thrilling for me to hear about all the work that went into Atlas and how different states will be using this incredible resource to enhance their existing measurement efforts and improve the quality of care available across the country. Genuine, heartfelt thank you to our state representatives for taking the time out of your busy schedules in the midst of a pandemic, no less, to share your experiences with us. And congratulations to the 6 states launching Atlas right now. It will no doubt be an incredible resource for the people that you serve. So to wrap up our discussion here today, we will hear from 2 of our Shatterproof ambassadors. Shatterproof ambassadors, I just want to make sure, yeah, okay. Shatterproof ambassadors are part of a national network of volunteer peer leaders who educate and empower others to learn about and support Shatterproof's mission. I can think of no better way to conclude our event than by hearing from individuals with lived experience about how Atlas will impact them and the communities which they serve. So, and forgive me, I just want to make sure we have our ambassadors on. Do we have them on? Yes, we do. I don't know if I have an order here. How about if, would Ms. Tony Woods like to go first?
Absolutely, yes, thank you. Hello, everyone. I am happy to be able to share with you today. I am Dr. Tony Woods. I have the privilege of being a Shatterproof ambassador in the state of North Carolina. I have been impacted by substance misuse on a community level. And as a result, I am dedicated to providing substance use support services. I have compassion for people and a strong desire to help people reach their fullest potential. I am an independent licensed clinical addiction specialist associate, and I know the devastation of addiction firsthand. I use a holistic approach to treatment, integrating cognitive behavioral therapy and yoga for addiction management. In my years of service, I found that the most crucial component to ongoing success of sobriety includes a commitment to high quality, evidence-based treatment and the ability to find resources specific to the individual's needs. That's why connectivity is so important. Finding such resources has been a challenge for a long time. So I plan to make Atlas available to my patients as a resource that allows them to research facilities specific to their needs, from level of care to facility locations to program needs and their insurance coverage. I am grateful that Atlas can lead the way for this area of connection in their lives and sobriety. Advances like Atlas recognize addiction as a disease and will undoubtedly save lives. That's why we're here. So thank you for allowing me to be a part of today's incredible launch.
Thank you, Dr. Tony Woods, for sharing your experiences and your thoughts. It was greatly, greatly appreciated. And I'd like to introduce our next Shatterproof ambassador, Mr. John Purcell. The floor is yours.
Thank you. And thank you, Shatterproof. Thank you, Gary. I was in my late 20s. I had untreated depression, anxiety, and I descended into substance use disorder. Opiates and benzodiazepines brought me temporary relief, but my obsession with moments of artificial calm started to erode every relationship in my life. And then began the chorus of voices, family, friends, even the voice of my formerly healthy self joined in. You need to get help. I will always love you, but I can't be your friend until you get help. And it was time to get well. Finding treatment online back then, in 2009, it was a minefield. There were scams, there were dead ends. I knew I probably needed dual diagnosis care. I knew probably non-12-step, but which facility? Would my insurance cover it? And was it even legitimate? It was my responsibility to find treatment, but there were no resources like Atlas, and there was no way to narrow my search to give myself the absolute best chance. So I would call them, I would call number after number, and in my condition, it was very easy for them to lure me with a free flight or promises that I could have a cigarette break in between groups, tempting perks for an addled mind. So my official effort to get well began with my first rehab in 2009, and I'm not sure I ever found the right treatment. I had some wonderful therapists and doctors and groups, and I don't mean to discount them. After 8 years of drug use, me and my tired brain and my atrophied body we all decided enough. And I suppose that's how everyone gets better at some point, but maybe it could have happened faster. It's been 3.5 years since I injected heroin, 3.5 years since I've taken a benzodiazepine, but it took 8 years, 8 drowsy years of Russian roulette as friends and family wrung their hands that maybe John wasn't coming back. So if you're in a cycle of opiate use, you don't have 8 years. I was, and I am, extremely lucky. Among many others, I lost 3 of my friends to overdose, all from the same sober living in the San Fernando Valley. And now I think, what if they had some access to something like Atlas in 2014? It's not a new idea. Shatterproof is finally doing it, and they're doing it right. I imagine my departed friends having had a universal starting point, one they might have used to pinpoint a path to true recovery, and they might still be here. We've got to stop losing people this way, and we are going to stop losing people this way, and Atlas is absolutely going to help. Thank you.
Thank you both. And I want to make sure the audience knows a little bit of background on both of our incredible Shatterproof ambassadors. Dr. Tony Woods of North Carolina, Shatterproof ambassador and licensed clinical addiction specialist associate. Thank you for sharing your gratitude for the Atlas tool, which you know will enhance your life's work supporting those with substance use disorder and mental illness. And Mr. John Purcell, an artist and entrepreneur living in Massachusetts. Thank you for speaking about your experience navigating your own treatment path. My personal to you, congratulations on your long-term recovery. Congratulations. So for closing remarks, thank you again, John. Thank you, Dr. Woods, for sharing your powerful stories. And thank you to everyone who came on board listening and for joining us today and taking time out of your busy schedules to join us. It is clear there is much more work to be done to address the nation's addiction crisis, from reducing stigma to promoting the adoption of Atlas. And I am just so grateful to all of you for the work that you've been doing. I just want to make sure that I'm capturing everything else that I need here. Yeah, so thank you all for the work that you're doing. And following this live stream, let me just add, if you have questions or want to learn more about Atlas, please visit treatmentatlas.org. More information on Shatterproof and how to get involved is available at shatterproof.org. Following this live stream, there will be an official press call beginning at 12:30. We thank you for joining today's events and would like to now end closing remarks. Thank you. Bye.
Thank you so much to everyone for attending. We'll now show our credits of our partners that have been involved in our work. For those that will be joining the press call, please stay on the line. That will begin at 12:30. Thank you.